Dave, thank you so much for coming on in such short notice. And just wanted to talk about what's going on here. In general, this has been a huge ordeal with coronavirus and trying to battle it, and to really figure out how to deal with it on a local level. And I've seen a lot in the news about NorthShore developing their own tests, and it's available. But I want to hear from the source and hear what's going on your end.
Hi, Aaron. Great to be with you, and I appreciate the opportunity to talk with you and reach out to the community. Yes, NorthShore is, I think, still the only independent hospital that has developed its own COVID-19 test. However, it's very important for everyone in the community to realize and understand that we will only be testing symptomatic individuals who are probably febrile and present upper respiratory symptoms. Why is that? We simply just don't have the capacity today to test everyone in the community in a blanket manner. It will overwhelm the system. I believe the CDC is going to be sending out more test kits across the state. That'll help, but right now we have to reserve tests for people who are potentially symptomatic with COVID-19. And why that's important. So let's start from the beginning. What is COVID-19? This is a novel coronavirus. Coronaviruses are not new. We get them every winter. We get colds from them. But this is a new COVID virus, and therefore it is spreading person to person. And what makes this a little bit different than others is that it is a little bit more contagious than most viruses are. And so, according to the CDC, it's go ahead, Aaron.
Is it airborne, or is it just like how is it contagious?
So, according to the CDC, they define it as a person-to-person spread, and it's between people who are in close contact with another, usually within 6 feet. That's why the whole concept of social distancing is very important. If we can keep people from gathering in crowds in crowded restaurants and bars and concerts and sporting events, it minimizes the amount of close contact we have with other people, and therefore we minimize the velocity of the spread of this virus. It's spread through respiratory droplets from usually an infected person when they cough or sneeze. There's a question out there: can somebody spread it without being sick? Certainly possible, but people are most contagious when they are symptomatic. So when they're coughing, sneezing, and therefore those droplets are spreading person to person and in the air and getting on hard surfaces. That's when the spread and people are considered to be most contagious. Mm-hmm. So right now, the most important thing is that we limit person-to-person contact and we adhere to the social isolation to minimize the community spread. So you'll hear the term flatten the curve. Right now, we're seeing an increase in cases, significant increase daily. If we can keep that exponential rise from continuing to be exponential and start flattening it out, we can get on the other side of this. Just to give you some facts, as of yesterday, around the world, there's about over 181,000 cases of COVID-19 or coronavirus. In Illinois, as of yesterday, we have about 105 confirmed positives. And we've tested in the state about 1,038 people. So we've tested a lot, and only about 10% or so were confirmed positive. But then there's another 1,143. There's 1,143 who were under investigation. We have 105 confirmed, and we've 1,038 are confirmed negative. Okay. Here's the good news. The 81% that do test positive for COVID-19 have mild illness. And that is important because that informs what the treatment's going to be, and that is going to be you're going to stay home, you're going to self-quarantine, you're going to try to stay away from your family members if you can, drink a lot of fluids, and just like you would treat a cold or a flu, over-the-counter medication, and you're going to stay inside until you have no more fever without taking fever-reducing medicine like Tylenol or Advil, and you are asymptomatic. And that is going to stop the spread. Most people do not need to be hospitalized for this illness. And the only reason we are testing is to identify who's positive so we can say, yep, you have it, but you have mild symptoms. Don't go to work. Don't go to the grocery store. Don't go out about town. You want to self-isolate until your symptoms are done and your fever is gone. And that's going to stop the spread of the disease. There really isn't a direct treatment or a direct cure for this virus at this point. It is all supportive therapies. Those, again, 81% are going to have mild illness, and so they're going to go home, rest, fluids, and watch bad television until the fever and symptoms go away. Only for our oldest members of the community and those who have comorbidities that make them more vulnerable. So people with bad immune systems, have cancer, have lung disease, currently older adults, they are going to be at the highest risk for developing complications. And those are the folks that we want to make sure the healthcare system is open for to take care of. So a couple things to remember. Mild symptoms, you're going home. Mild symptoms, and you don't have risk factors.
Yeah.
But if you start having trouble breathing, if you're getting very short of breath or chest pain or getting confused, you're having difficulty staying awake, or your lips or face are turning blue, you want to call 911. Now that's going to be a very small percentage of the population. So there's a lot of anxiety out there, and I understand because we're in unprecedented times, but I want to go back to 81% have mild illness, and they're going to get fine and better completely on their own. But if it progresses from mild illness to any of those symptoms, then you do want to seek emergency help. If you're not quite at that place, but your symptoms are progressing and getting worse, call your doctor before you go anywhere, and they will instruct you what to do next. In addition, I want your listeners to know NorthShore University HealthSystem has set up a hotline with clinicians and nurses triaging. It's 1-847-HEALTH-9. 847-HEALTH-9. And that is another great resource for the community. They can talk to a nurse and talk through their symptoms, and they will guide them to where to go next. In addition, if you go to northshore.org and our webpage, there's a link there for coronavirus and COVID-19, and you can also do an e-visit if you can also do an e-visit for most of our patients, and somebody will walk you through, based on your symptoms, what to do next. I ask folks out in the community just to be patient. As you can imagine, the 847-HEALTH-9 and e-visits, we're getting to all the calls as fast as we can, and we've redeployed nurses and clinical staff to meet the demand. So be patient if we don't answer the phone or respond within a few minutes, but we have people working to ensure that we can give the community sound medical advice and take the next steps.
Can people go to any of the hospitals, or do you want them to go to specific hospitals if they have the symptoms that you described?
And the closest hospital. So any of our NorthShore hospitals, if they have trouble breathing, shortness of breath, chest pain, confusion, difficulty staying awake, starting to get a little blue, then call 911 or any of our 4 hospitals, and we'll take care of you from there. We have identified 4 of our immediate care centers. Our immediate care center on 2 wheels, our Old Orchard on Old Orchard Road, our immediate care in Lake Bluff, and our immediate care in Gurnee. That is where we are sending anyone with fever and upper respiratory symptoms to be treated. Those are our COVID-19 immediate care centers. So not every immediate care will necessarily will be able to handle COVID-19. We want to save those for the non-COVID-19 patients. But again, the best thing to do is call your doctor before you go anywhere, or call 847-HEALTH-9 before you go anywhere, or perform an e-visit unless your symptoms are such at a point where it becomes a medical emergency. Then you're going to the emergency room or calling 911.
Mm-hmm. And are you guys still doing the regular services at the Skokie Hospital for orthopedics, or are you suspending that right now to be able to take care of what's going on?
Yeah, Aaron, good question. So for any emergent or urgent condition, including orthopedics and spine, we've continued operating and offering services. And this goes for our entire health system. But for anything that is not urgent or emergent, something that's not going to cause a threat to life, limb, or critical function, we have postponed those elective procedures and those elective visits for a later date until we get on the other side of this COVID emergency. We want to preserve as much of our personal protective equipment. We want to preserve supplies, and we want to ensure that we have personnel and inpatient beds for if and when this COVID-19 pandemic surges in our community. So it was the prudent thing to do. We followed the American College of Surgeon guidance and the U.S. Surgeon General's directive, but we do still have office hours within the NorthShore Medical Group. And we still have essential outpatient services. Our goal is that if you have a condition that needs to be managed, and it would get worse, that if you didn't see your doctor or get a test, we want you to see your doctor, or at least do a video or phone visit or get your test, so you do not end up in our emergency room unnecessarily, or do not get admitted to one of our hospitals unnecessarily. Again, we need to save those resources for any potential surge in the coronavirus. So your doctor will be calling and reaching out to you if you have an appointment, and if it's important that you have it, it will continue. If your doctor feels, no, I really need you to have this X-ray, MRI, CT, echocardiogram, whatever it may be, because you might get worse over the next 90 days or so, we absolutely will be open and ready to handle that. And likewise, if you need an urgent or emergent surgery or any type of procedure, we are absolutely going to be there ready to handle that. We just want to, anything that is non-essential right at this moment, we want to make sure we conserve our people, our supplies, and our beds for a potential surge in patients.
That makes sense. And are you coordinating with the other health systems throughout the area besides, North Shore?
Absolutely, Aaron, and really the state of Illinois and Illinois Department of Public Health and Governor Pritzker have done a great job of really bringing the state together, issuing very clear directives, and we are coordinating with the state health department as a community of healthcare providers. And we are all trading resources on a daily basis and are trying to help each other to ensure that we are working together to best prepare for this pandemic.
Wow. Is this something that has been trained for a pandemic? So a lot of the plans are going into place now that people have been training for years?
Yeah, Aaron, absolutely. Those of us who are in first-line responders and our healthcare providers, we have been training for years and trained regularly on doing tabletop drills, emergency preparedness drills, simulation drills for any number of scenarios. And so that training is proving to be beneficial here, because we don't have to reinvent wheels. Right. We have to dust off a few things to go, wait a minute, what did we come up with? But we have those plans, and now we're just tailoring it to this particular scenario and situation. So we feel very prepared. We've set up a corporate-wide system labor pool where anyone who is, because of less elective cases and some cancellations of office visits, we are ensuring that we're redeploying our physicians, nurses, staff to where the area of greatest need is across the system. So we have systems and processes and structures to really tackle this as a system of care and make best use of every single one of our assets. The most important one that we have is our people, to ensure we can keep our community safe.
Well, thank you for what you're doing. I mean, this is we're not doing the drill now. So you guys
this is not a drill. No,
this is not a drill, but it's
at the same time, I think I want to go back to, it's also that we stay calm as a community and really adhere to what the instructions out there are. Right now, the instructions are we need to socially isolate. This is not the time to plan a party. This is not the time to go out to dinner. This is not the time to be in a place with a lot of people. Go for a walk outside. Keep 6 feet away from other people as you're ideally passing them by. That's great. Fresh air never hurts. If you are out and about and have to go to the grocery store or something essential, don't touch your face and wash your hands often. If you do come in contact with anything, just wash your hands. Simple
Right.
common sense stuff. If you're sick, stay home, and know that 80-some% of the people who contract this virus have mild symptoms, and they're going to get better with just fluids and supportive over-the-counter medicines, and they're going to be just fine. And for those that fall into the 20% that need a little bit more help and support, we are here to help and support.
Thank you. Well, I'm being kicked out of my studio here because my wife has been transitioned to digital tutoring sessions because she can't meet with people in person. We're practicing self-isolation, but Dave, thank you so much for coming on. Stay on for just a minute. I'm going to end the live broadcast to Facebook, but I really appreciate it. And just hang on just one moment.